This podcast will talk about oxygen ventilation and some of the diagnostic tests with some general information about each. Hello, this is Susan Knowles from Cochise College Nursing. Welcome to this podcast. Some of the diagnostic tests or laboratory tests that are done in the process of diagnosing a patient with a respiratory condition, oftentimes a complete blood count is done. This is to search for possible infection, maybe even anemia, or just as a baseline lab result. A chemistry may be done for the same purpose, predominantly for a baseline result, or to look at the metabolic condition of the patient. Blood cultures would be done to look for a systemic infection. Skin tests perhaps for allergies if the person is continuously having respiratory symptomatology. Sputum cytology would examine a small sample of sputum or mucus under a microscope to determine whether abnormal cells are present. And sputum is not the same as saliva. Sputum is produced in the lungs and in the airways leading to the lungs. It could also be collected not only by actually the patient bringing up the mucus through a cough, but also through bronchoscopy, and we'll talk about that in just a moment. Throat cultures can be done to obtain the organisms in the back of the throat. It could either be bacterial or viral, but predominantly they're searching for bacterial involvement. A lung biopsy could be done through a needle lung biopsy, which is performed when there's an abnormal condition that is either near the surface of the lung or in the tissues surrounding the lungs, or maybe even on the chest wall. The test can be performed to obtain a sample for culture when infection of the lung is also suspected. The sputum or bronchoalveolar lavage cultures have not identified the cause of the infection, which is also another thing that can be done during a bronchoscopy. A chest X-ray is a procedure used to evaluate organs and structures within the chest for symptoms of disease. So a chest X-ray can include images of the lungs, the heart, small portions of the GI tract, thyroid gland, as well as bones of the chest area. So if they're looking for chest trauma, in addition to whether or not the lungs are actually fully inflated, things like that, they can see that on chest X-ray. A spiral CT is a CAT scan that is done using the X-ray machine that rotates continuously around the body, following a spiral path to make cross-sectional pictures of the body. The benefits of a spiral CT are that it can be used to make these three-dimensional pictures of areas. It may detect small abnormalities better than a conventional CT, and it's also faster. An MRI is a non-invasive nuclear procedure for imaging tissues of high fat and water content that cannot be seen with other radiographic techniques. The MRI image gives information about the chemical makeup of tissues. Therefore, it makes it possible to distinguish normal or cancerous, atherosclerotic, as well as traumatized tissue masses. A diagnostic bronchoscopy is a procedure performed with an endoscope in order to inspect the airways of the lungs. The most common reason that bronchoscopy is performed is to establish the diagnosis of a mass or a tumor. It could be used also to identify the site of bleeding or the cause of bleeding, which if a person is having symptoms of coughing up blood and they want to see whether or not there are reasons for that bleeding in the airway somewhere. Also, it can be used to evaluate or also to help treat pneumonia or determine the consequences of trauma. As I mentioned before, a diagnostic bronchoalveolar lavage or washing, transbrachial needle aspiration can be done. or a biopsy, which is performed during the bronchoscopy. Patient can also have a therapeutic bronchoscopy, and that is a bronchoscopy that can be used in the treatment of airway obstruction by tumors or foreign bodies during the removal of secretions, and as well as an assistive technique during difficult intubation of the trachea. So when someone's trying to put an endotracheal tube in to help permit better ventilation. A VQ scan is a ventilation and perfusion scan. They can be done separately so that there's only one or the other done, or they can be done together to diagnose lung diseases. And both scans are done. If they are both done, it's called a VQ scan. A lung scan is a nuclear scanning test that's most commonly used to detect a blood clot. So that would be a pulmonary emboli that's preventing normal blood flow to a part of the lung. The ventilation scan is a radioactive gas. The patient has been given this gas or mist to inhale into the lungs, and the pictures from the scan can show areas of the lung that are not receiving enough air or that retain too much air. In the perfusion scan, a radioactive tracer substance is injected into the vein. And then it travels through the bloodstream and into the lungs. So the pictures from that scan show areas of the lung that are not receiving enough blood. The tracer is absorbed evenly in areas of the lung where the blood flow is normal, and where it is not, then those places are actually called cold spots. You're familiar with pulse oximetry, and you know that that's a non-invasive method that allows for monitoring of the saturation of a patient's hemoglobin. It actually measures the saturation of oxygen in the blood, and the results are often used as an estimate of blood oxygen level. Normal pulse oximeter readings range anywhere from between 95 to 100% under most circumstances. Any value that's less than 90 is considered low. Pulmonary function tests are a group of tests that measure how well the lungs take in and release air and how well they move gases like oxygen from the atmosphere into the body's circulation. They are done to diagnose certain types of lung diseases such as asthma, bronchitis, as well as emphysema. They can find the causes of shortness of breath. They can measure whether exposure to chemicals at work affect lung function. They can check lung function before someone has surgery. And they're also done to assess the effect of medication. They can monitor and the progress of disease as well as treatment. ABGs, or arterial blood gases, measure the acidity or the pH and the levels of oxygen and carbon dioxide in the blood from an artery. It will help to determine how well the patient's lungs are able to move air into the blood and remove carbon dioxide from the blood. Thoracentesis is a procedure to remove fluid, not blood necessarily, but fluid from the space between the lining of the outside of the lung, the pleura. And we've talked about the pleura before, that there are two layers of the pleura and there's only supposed to be a small amount of fluid here. And that's just to help with lubrication between the two layers. But if there is an increase in the amount of fluid that's collected in this space, then in order to remove it, they do that procedure called a thoracentesis. Because if there's too much fluid there, it will actually cause the lung to collapse. So a needle is placed through the skin and muscles of the chest wall into the space around the lungs, and then the fluid is collected and it may be sent to the lab for testing, which is called pleural fluid analysis. Normally, as I said, very little fluid is in this pleural space, and a buildup of too much between the layers of the pleura is called a pleural effusion. Now let's talk about a chest tube insertion. A thoracentesis is an intermittent procedure. A chest tube is a hollow, flexible tube that's inserted in the chest, and it acts like a drain, much like thoracentesis, but it's more considered a continuous procedure where the person is placed on either gravity or suction to remove fluid around the lungs. So a chest tube will drain blood, fluid, or air, and it allows the lungs to more fully or to fully expand. The tube is placed between the ribs and into the space between the inner lining and the outer lining of the lung, so the pleural space. So it's the same place that a thoracentesis is inserted. The tube is connected to a bottle or a canister, and the suction is used to help it drain. After the tube is inserted, often it needs to be kept in place, so it's sutured into place and then it's taped. Let me just talk about a little bit about the post-op care, because it is important. Not that you're responsible for it at this point, but in the future you'll talk about chest tubes again, and it's important to have a general idea about the post-procedural care. The patient needs to have their respiratory status assessed at least every 4 hours, and as well as the chest tube, because you need to know whether or not the chest tube is actually functioning properly. They need to have a closed system, so all of the connections need to be taped and secured. You do not want to have any kind of disruption or removal inadvertently of the tube. You need to keep the collections apparatus below the level of the chest. The tubes need to be checked frequently for kinks or loops, which could interfere with drainage. You need to check the water seal frequently, because the water level should fluctuate with respiratory effort, and if it doesn't, the system may not be patent or intact. So periodic air bubbles in the water seal chamber are normal and indicate that trapped air is being removed from the chest. Measured drainage needs to occur about every 8 hours, marking the level of drainage on the drainage chamber. And then, of course, you need to document and report any drainage that is cloudy or in excess of about 70 milliliters per hour, or if it's red or free-flowing red. And those are the, we as nurses would also help the patient with frequent position changes, when they sit up, when they ambulate. And chest tubes should not prevent performance of most activities. And that's the general care of a patient with a chest tube. Thank you for joining me on this podcast.